Good afternoon, everyone. Last night, Officer Grant of the Springdale Police Department in Hamilton County was killed. Our thoughts go out to her family. We're so very, very sorry for her loss. I know that she was a very well-respected officer of the department. Injured was Officer Davis, and we're thinking about him as well. I've ordered the flags in Hamilton County to fly at half-mast between now and Officer Grant's funeral. I've also directed that the flags here at the State House fly at half-mast in her honor. I've also ordered that the flags in Mahoning County, as well as the State House and the Rife and the Rhodes buildings, fly at half-mast for Representative Don Manning. Don Manning died, as we talked about yesterday. And again, we were thinking of his family as well as Officer Grant's family. The General Assembly is coming back into session next week, and I know they'll be taking up a number of issues. One of the issues that I am asking them to take up has to do with the state-mandated testing for our school children in Ohio. I think it is time for us to make the decision, and I'm asking them to forego testing this year, state-mandated testing. The Board of Pharmacy met in emergency session and passed an emergency measure today, and I thank them for that. In regard to what has become a rush on a drug and drugs, and that is malaria drugs. They set out provisions, specific provisions, in regard to the prescribing of this drug. This drug will be allowed to be prescribed for its intended purposes. It certainly will also be allowed to be prescribed for COVID-19 for someone who has tested positive for that. Again, this was an action that was necessary by the Pharmacy Board, and I thank them for doing that. My fellow Ohioans, we have not faced an enemy like we are facing today in 102 years. You have to go back to the 1918 influenza epidemic. We are certainly at war. I don't know any other way to describe this but to say that we are at war. In a time of war, we have to make sacrifices. And I certainly, in the last week or so, have asked the people of Ohio to make many sacrifices. And I thank each and every one of you for all that you are doing every single day, all that you're refraining from doing, how your life has changed. Not something we wanted, but I thank you for doing that, because what you're doing is making a huge, huge difference. I am convinced that we can do this. We can do this. I had someone yesterday say to me, you know, Mike, we can do this. We're strong. We certainly can do this. We're Buckeyes. I would say to that, absolutely correct. We are Ohioans. We are Buckeyes. We're strong. We can get through this. We can do this. All the evidence shows, every piece of evidence that I can lay my hands on indicates that we are at an absolutely crucial time in this war, and that what we do now will make all the difference in the world. What we do now will slow this invader. It will slow this invader so that our healthcare system, our doctors, our nurses, all the professionals, the hospitals, will have time. We'll have time to treat the casualties. will have time to treat those who have come down with COVID-19 and also have time to treat everyone else who might have had a heart attack or might have had a stroke or some other medical problem. Time is of the essence, and we have to buy that time. We have to do it by the strong actions that you all have been taking. We're now at a new stage, continuation of what really has been going on. Dr. Acton, who has done such a phenomenal job, just signed an Ohio Health Director's order. Dr. Acton just signed a stay-at-home order for all Ohioans. Other states have referred to this as shelter in place. We prefer stay at home. Either one, it's pretty much the same thing. And that order will be up online shortly. You'll have the opportunity to look at it. But let me just start by saying that there really is nothing in that order that we have not already been talking about. There's nothing in that order that I have not been asking you to do for the last week or so. This order has really three separate parts. The first part is stay-at-home order. And it allows, this is the copy of the order that Dr. Acton just signed. It is self-explanatory. I think for a government document, it's pretty easy to read. But it does permit exceptions to staying at home. And these are the common sense ones that we have been talking about. Leaving home for essential activities is permitted for health and safety, for necessary supplies and services, for outdoor activity. Take a walk, walk your dog, go to a park. Although playgrounds, which are particularly susceptible to the spread disease, are closed. Certain types of work that's deemed essential, and I'll talk about that in a moment. And the final one, E on page 2, to take care of others. We don't want anyone to misunderstand. You still can take care of your neighbor. You can still take care of your mother, your dad, your child. I'll just read from it. To care for a family member, a friend, or pet in another household, and to transport family members, friends, or pets is allowed by this order. This includes attending weddings and funerals. Again, it's common sense. The second part of the order lists the essential businesses that will be allowed to stay open. And I want to point out that we use the Homeland Security document identifying essential workers. This document has been used, I know, by several other states as well. And I think these are generally the accepted businesses that are essential for us to continue to live. For each, the third part I would like to talk about is that each of the businesses that are allowed to stay open must follow good protocol, good guidelines in regard to health. Let me turn to page 8 and read some of these. Again, nothing new, nothing that we have not been talking about, nothing that Dr. Acton has not been talking about. For purposes of this order, social distancing requirements includes maintaining at least 6-foot social distancing from other individuals, washing hands with soap and water for at least 20 seconds, and on and on. Required measures, businesses, designate 6-foot distances. Workers should not be any closer than 6 foot, and it talks about that. Hand sanitizer and sanitizing products must be readily available for employees and customers. Number 3, separate operating hours for vulnerable populations, implementing separate operating hours for the elderly and vulnerable customers. Online and remote access, posting online whether a facility is open and how best to reach the facility, and continuous services by phone. And there's many more. But these are just basic, common sense things that we have covered. But the businesses that will be able to remain open will be subject to these specific, what is now an order. This document, these orders can be enforced by the local health departments as well as local law enforcement. The order will go into effect tomorrow night at midnight. So at actually 11:59 p.m. Monday night. It will stay in effect until April 6th. We obviously will reassess that order at that time. Let me talk for a moment about daycare. As the days have gone on, the number of children in daycare has gone down dramatically. If you look at the state-subsidized daycare, at the beginning of the coronavirus, there was 117,000 children in daycare subsidized by the state of Ohio. That number has gone down to about 17,000. So it's gone from 117 down to 17,000. We do not have good numbers in regard to private daycare, where the state is not involved. The best estimate is that there was about 183,000, and there could be around 40,000 in daycare today. The obvious concern in regard to daycare is when you're putting a large number of children together, the social distancing does not work too well, and children are known to share about everything. So we have known that this is a potential challenge. As I said, we've seen these numbers just with no real action by the government go down appreciably. It is time now to move to that next stage with daycare. And our goals are to keep the kids safe, keep the families of the children safe, and also to make sure that there are enough essential workers, starting with the healthcare industry, to be able to man our hospitals and to do the jobs that need to be done. So we will have a change in daycare, and this change will start on Thursday. All centers beginning on Thursday must operate under a temporary pandemic child care license. And I know some centers have already applied for that, and that is in the works with some of them. We are going down to a maximum of 6 children per room. 6 children per room. This is a rather dramatic change. But I felt that was necessary to minimize the risk to these children from other children in regard to coronavirus, but also the risk that poses to that child's family when that child goes home. By putting them into groups of 6, we are minimizing that risk and, in a sense, compartmentalizing these kids. And let me read a part of what the order will say. Small group sizes, no more than 6 children in a class. Ratio in group sizes, let's see. Reduce ratios to 1 teacher to no more than 6 children. Limit use of shared space or mixing of groups. If shared space is used, must have a rigorous cleaning schedule, and we would recommend actually not having common space so that you would have the 6 children who would be in one unit. The goal is to keep children of parents of the same employer together whenever possible. Again, to try to keep down the risk. Limit parent interaction at the drop-off and pickup. This program will operate until April 30th and certainly may be extended beyond that period of time. Let me now turn to Dr. Acton for comments, and then Lieutenant Governor Jon Husted.
Good afternoon, everyone. I'm going to begin, as I always do, with the numbers. And I must say again, these numbers are pouring in to us. I'm hearing of cases that are happening at the local level but have not yet been reported to the state. So what I give you when I give you this data is what is known usually earlier in the day that we make final on our website at 2 p.m. Today we have 351 confirmed cases in Ohio, which, as we know and we have spoken of, is the tip of the iceberg of what we're seeing. We heard news of someone close to us just on our way in here that I know isn't in this data. The illness onset range is February 7th through March 22nd. The age range remains 1 year of age to 93 years of age, with a median age of 51 years. We have 83 hospitalizations, numerous ICU. We still have 3 deaths that are confirmed in Cuyahoga, Erie, and Lucas. We now have 40 counties confirming cases in Ohio. I've said over and over to you that every one of us matters and every day matters, but today is the day that matters. Today is the day that we have to batten down those hatches. Today is the day we're doing, the final orders about staying at home and moving to a model of essential business. I want to tell you that it's absolutely essential in Ohio that we don't do this in a piecemeal way or even around this country. It's absolutely what the scientists are telling us. Again, today I'm exchanging messages and we'll be having a long conversation with the people who invented the model we're following, the flatten the curve. There's no time left. Listen to what Italy is telling us. Today is the day. We have absolutely got to do everything in our power, each and every one of us, to protect the people on the front lines, those essential people, those frontline responders and healthcare workers, those folks doing those essential businesses that will make sure that they protect us. They make sure that we have the food and the medicines and the healthcare we need. So we must protect them so that they can protect us. This is a war on a silent enemy. I don't want you to be afraid. I am not afraid. I am determined. But I need you to do everything. I want you to think about the fact that this is our one shot in this country. All of us are going to have to sacrifice. And I know someday we'll be looking back and wondering, what was it we did in this moment? There will be so many heroes. I'm following your stories every day. You're heroic when you stay at home and watch your neighbor who's a nurse's child. Everyone is being heroic right now, and I can tell you that every action you take is mattering. But this is that moment. It is our one shot. I can tell you that I already envision a future that is full of hope. I've told you my story about how absolutely essential hope is. It's the one thing that made a difference in a really rough childhood that I had. And I feel more hope than I've ever felt. I actually believe that life is not shutting down right now. Life is not shutting us down, although we're being quiet now and we're making that physical distance. Life seems like it's shutting down, but I feel like life is waking us up. I truly see a vision of a future that is brighter than we have known. I say that from all my heart. I just know it in my heart and soul. So please, don't feel like this is pulling us apart. I believe this is drawing us to each other and binding us to each other. But it will have to be all of us following the direction the governor is laying out to go into this battle and make these sacrifices. We will be with you every step of the way, and we'll continue to share everything as we know it. And I do see us on the other side. Please help us. Thank you.
Jon?
Thank you, Governor. I want to go through some things that we hope will serve as great resources for business. Just quickly on an overview of the director's stay-at-home order. The goal of this is simply to provide the clear game plan of what it's going to take for us all to defeat the coronavirus. And for business leaders out there and business owners, employees, this information, if it's not already up, will soon be at coronavirus.ohio.gov. Read it. The intent was to make it as clear as possible for you to have the guidance that you need to make the decisions that will help all of us. I want people to know out there, again, we do not do these things in isolation. We may not be physically together with people, but we consult business, labor, the not-for-profit community, all kinds of advocates to develop the policies that the governor is taking action on. And I know that on this particular order, know that we have the support of the National Federation for Independent Business. We have the Farm Bureau, the Manufacturers Association, the Retailers Association, the Ohio Business Roundtable, and the Ohio Chamber of Commerce, along with consulting with numerous other business and trade organizations, so that we could put something together that would keep us healthy and keep essential business functions in the supply chain moving. One of the things that businesses have been asking is, can we go to a central site to find all the information that is needed for us to help our employees or help with business disaster relief, et cetera. And we have that at coronavirus.ohio.gov/business help. That is available as a central location where you can find SBA disaster relief, information on the BWC premium deferrals until June, information on the liquor buyback for restaurants and bars, also the healthcare premium deferral that's being made available for 60 days. All of these resources to help cushion the blow, the economic blow that we know that you're facing. It is also important for you to know that while there are some businesses who won't be operating due to these restrictions, there are some businesses that are critical to the supply chain who are in desperate need of assistance. There are businesses all around the state who are hiring by the thousands. We've been contacted by Walmart, Kroger, Meijer, Giant Eagle, Marks, the part of the grocery grocery store supply chain who need your help. They are hiring. From Amazon, who delivers your packages, to Gojo, who makes the hand sanitizers that many of you use. Discount Drug Mart, I might add, pizza delivery, all kinds of convenience stores that provide gasoline, things of that nature. Much of that information for you is available at ohiomeansjobs.com. And you who are in the workforce, Governor has asked, well, he's ordered today that you stay home, except for those essential needs. And there are many of you out there who are working on the front lines to provide those essential needs, and we are grateful. We want to keep the businesses open that are part of that very supply chain that gives us the opportunity to live our lives with the food and healthcare necessities, et cetera, that we need. And so please continue to do those kinds of things. We need you. We're all in this together. And we thank you for the great work that you're all doing out there.
Happy to answer any questions. Scott?
Hey, Governor, thanks for taking my question. Scott Hallis, Xenia Daily Gazette, AIM Media, Ohio. You mentioned that the businesses who aren't exempted, that can be enforced by the health department and local law enforcement. What type of sanctions or penalties could these businesses that aren't exempt be facing if they are caught operating when they're not supposed to be?
Well, the first thing we would certainly want the businesses to do is to check. Take a look at this. I think that they will be able to figure this out by the document, but if for some reason they have a question, we can certainly answer that question. This was not designed to be punitive, but this is a health order. It's not a health suggestion. So it is a health order, and we would expect people to simply to comply with it. So it's not just, as I said, there's really three different parts of this order. All of them are an essential part of the order, and we would expect people to the businesses to follow that. Again, nothing shocking here if you look at how we are telling businesses that some of the safety precautions as far as health precautions, these are the same things that we've been outlining for some time, and Dr. Acton has been outlining.
Governor Jeff Reddick from ABC 6 News here in Columbus. Want to see if you can provide more information on testing. If there's any assurances about testing. Of course, everyone wants a test. It's going to take some time before that ramps up. Could that be within 30 days? And have you also heard anything, had any discussions about in-home testing that we've heard rumored might be available?
I'm going to let Dr. Acton answer that question in regard to the testing. Doctor?
Thank you. And I'll refer you again back to the last two press conferences that we've had for more details on this. We still remain with an incredible shortage of testing in Ohio. So we are reserving that testing capability for the highest risk hospitalized patients. That helps us decide how to best treat and sort of protect the others in that environment. You'll see that with clusters, some of our nursing home outbreaks. You'll see that used with our frontline first responders and those at most risk. I have great hope, as I've mentioned, and we'll be talking much more in the week to come about our hospital capacity, our surge. I'm really going to help Ohioans focus now where my focus is going to lie, which is on our response and doing this well to our best ability. But we do have medical facilities and Battelle and others inventing things as we speak, so that could change any day now. There was word of a new test that will be rapid, but they say it will be at least a month till that is actually online. So for now, most of us will not be tested. If we're suspected with the symptoms, your provider will talk to you about staying home and how to best take care of yourself. I know that's frightening to people, but we need to understand that is the truth. There is not widespread testing available, and so we are conserving those resources to use them very wisely to stop the spread of this disease.
This is Jackie Borchert from the Cincinnati Enquirer. I have just to get your carryout food, and who can go to a pandemic child care center?
Well, I'll take the restaurant question. Carry-out is still okay. You know, restaurants provide a huge percentage of, obviously, we would advise people to do the social distancing, do all the things that they need to do, but if they can come get that, pick that up. You know,
Coronavirus.ohio, your dog. What's so essential here is and the choices so that we can protect them to this.
The list of, because it's all,
and it's, you know, if everybody does stay at home, get out, we had to do a lot.
It is nomenclature states on what essential.
Well, it does.
I want everyone to focus on talking existing masks and our house where we keep making things for us and some all of this
For doctors, we've gotten a lot of feedback from people
going on of things to folks thoughtful about circumstances. We're doing. Listen to Italy. Slow this down enough. Everything we do will make a difference. But right now,
that we'll get access to it.
Healthcare workers, to them besides
Not is ways, just not a good regard to
sort of outline for
tell them, you know, They should just read it. Every time. And I'm very mindful.
Large congregations, we're not stay in touch using technology where you don't need overwhelming to others' business. I've got to go in because I.
Thank you. Well, that was a good hour.
If you could help us start.
Certain things that an order cannot.
This should not be. Certainly will. We're going to get through the truth. Tried to tell you. Had to know. Would see the this to a war. We'll see you all.